Hello everyone, my name is Idam Qureshi and I'm an internal medicine doctor in Bella Health and Wellness Clinic. For those of you who haven't already watched it, I will link our previous video that goes over some of the basics of COVID-19 below. I'd also like to remind all of you that we will be having a live stream Facebook event on March 25th at 5 p.m. Central Standard Time on our Facebook page, where we will be happy to give you updates on what's going on with COVID-19 and also answer any questions that we can at that time. So in the last video, we ended at this graph that showed that we are on the same trajectory as Italy. As early as last week, we have been seeing this graph, which shows what will happen if the healthcare system in our country is overwhelmed. We have also been told to flatten the curve, but what does that mean? What basically happened in Italy was that too many people showed up to the hospital at once, and they ran out of beds and supplies. It is projected that anywhere from 40 to 70% of Americans will end up being infected with COVID-19. Why is that the case? Well, first and foremost, this virus has a very long incubation period. For example, if you have the flu, you'll start showing symptoms within the first couple of days and then you stay at home. But this virus can take almost 2 weeks to manifest itself. That means that while patients are not having any symptoms, they're still out doing their regular activities and spreading disease. There's an interesting article in Reuters about patient 31 in South Korea. The patient had no symptoms, so they continued with their daily activity, including going to church services and restaurant buffets, and going out on the town with their friends. In the end, it is estimated that that patient exposed over 9,000 people to COVID-19. This should show you the impact that one individual can have, especially in a densely populated area. If you look at this graph, it shows the number of infected individuals by age in South Korea versus Italy. The reason the curves look almost opposite is because Korea has mass testing, whereas Italy does not. So you can see that the younger people in South Korea were more infected than they were in Italy. And that's probably the case everywhere, but the tests are just not being done. But the number of deaths do start going up after the age of 60. Currently in the US, we don't have enough testing kits. I was only given 5 for my clinic, which is nowhere near enough. And other clinics in the area have been given similar numbers. Due to the shortage of kits, we have a more stringent testing standard, resulting in most Americans not being able to get tested. The other aspect is how the disease manifests. So if we look at the data from China, 81% of infected patients will have mild or no symptoms. 14% of people will have severe symptoms requiring hospitalization, and 5% will need critical care, with approximately 1% dying. Let's discuss what that means for our country. So we have a population of 327.2 million people. Let's be optimistic and say 40% of those people will get infected, so that's 130.9 million. And 14% of those will require hospitalization, so that's 18.3 million. And another 5% will require critical care, so that's 6.5 million. And with a 1% mortality, we're looking at about 1.3 million deaths. On the flip side, according to the American Hospital Association, we have a total of less than 1 million total beds in the United States, with less than 10% being ICU beds. These are very sobering statistics and show how quickly our healthcare system can be overwhelmed. Remember, we're still in flu season, so hospitals are still seeing an influx of patients that have the flu. There is a limited number of doctors, nurses, techs, and other healthcare staff available out there, and that number is not going to magically increase for this pandemic. And remember, people with other healthcare conditions such as heart attacks or strokes will still come to the hospital. On top of that, the lack of supplies that are available for our frontline healthcare providers to protect themselves, and the lack of kits that are available for us to test people, is putting our providers at risk. But it doesn't have to be that way. So what can you do to help? Stay at home. Please, stop traveling, stop going to the movies, the bars, and the restaurants. The CDC now recommends that you should not be in any place that has more than 50 people. Work from home if you can. Keep your kids at home. Have your groceries delivered or do a curbside pickup. I was at the local HEB a few days ago, and I walked in and walked out. There was a line stretching all the way to the back of the store. There had to be several hundred people in there, and there were people coughing and sneezing. This is what we're trying to avoid. So if you're into panic buying, you're actually exposing yourself and your loved ones to more danger from this virus. I know this is inconvenient, but this is where we're at right now. Stop hoarding supplies. I saw an article about people who went around buying up hand sanitizers and wipes and N95 masks. People with tens and thousands of these products who were selling them for astronomical prices online. I can't even begin to tell you how irresponsible this is at a time like this. We are all one people in one country. Just because you have 10,000 bottles of hand sanitizer or 200 rolls of toilet paper does not mean that you will not be affected by this virus. And you have created a significantly worsening problem for people on the front lines who are trying to save you and your family members. Hospitals and ERs are running out of protective equipment, including N95 masks, gloves, gowns, and hand sanitizer. Your doctors and nurses who are out there trying to fight this war for you are being sent to battle without the tools to protect themselves. A few days ago, the CDC relaxed their standards on personal protective equipment. This is not based on data. This is based on lack of supply, and this is insane. If you have N95 masks, hand sanitizers, gloves, or protective gowns that you have left over from a construction or painting project, or if you're one of those people who are hoarding them, please do yourself and everybody else a favor and drop them off at your local ER or hospital. Remember, the collapse of our healthcare system puts everybody at risk. It will be catastrophic, and the number of deaths will go up exponentially. If you don't believe this, just look at what's happening in Italy. If you're sick or at higher risk of infection, self-quarantine immediately. The most common symptom in the first week of this virus is mild malaise. By the second week is when you start seeing symptoms like fever, cough, and shortness of breath. We're also noticing some GI symptoms such as nausea, vomiting, and diarrhea. If you are experiencing these symptoms, please call your primary care physician to see what the next steps are. Do not show up unannounced to their office or to any urgent care or ER where you can spread this virus. If you are having trouble breathing, have a high fever, feel dizzy or lightheaded, please call 911 and accurately report your symptoms to the dispatcher so that the EMS crew that comes and the hospital that you're going to can be prepared. What does quarantine mean? It means that you isolate yourself in a room, in a bathroom, away from everybody else. You should not be sharing anything with them, including eating utensils. FaceTime with your loved ones instead of going out to meet them. Especially avoid high-risk populations, such as those with heart disease, lung disease, diabetes, cancer, adults over the age of 60, infants under the age of 1, or pregnant women. We're already well past the point of containment of this virus. The only thing we can do now is to slow the spread so our healthcare system will not be overwhelmed. And that responsibility falls on each one of us. So start panicking, start thinking rationally so that we can all become a part of the solution and not a part of the problem. Remember, we will get through this just as we have gotten through everything else. The goal is to keep the death count as low as possible. As always, stay safe. Until next time, bye.